Welcome, Dr. Keith Latson and Dr. Scott Fleming. This is the Full Bucket Show on hoof care, and so we're really excited to talk to an old colleague and good friend, Scott Fleming. Scott, yeah. So Scott, if you don't mind, I mean, you are so experienced and knowledgeable of the hoof. I don't want to get into the weeds from the beginning, but if you don't mind, um, talk about something as basic as what's a proper farrier schedule? Be here 4 weeks, 8 weeks, 6 weeks. I mean, 12 weeks. What do you recommend?
I really think it depends on the horse. We have to treat every horse as an individual. I would say as an average, most people 4 to 6 weeks would be sort of that common agreement, length of time. But there are horses that, especially, young, still in development and have some issues that a 2 week schedule may be more appropriate for them. So, and there are horses that I come back and check on at 6 weeks, and I have therapeutic shoes on them, and they're not cheap. So if they've not grown much and they're still doing what I want, mechanically speaking, then I might push those horses to even 8 weeks. It really just depends. But certainly the average would be 4 to 5 in our environment. With some of the therapeutic type cases, we want to try to manage that hoof capsule, in as a finite area before things start kind of growing beyond what we're looking for mechanically speaking. So the 4 to 5 weeks would be our average here.
Okay, so safe to say that it can be horse to horse based off of how rapid the hoof grows and what sort of wear the animal's putting on the foot.
That's right.
What about moisture? There's a lot of horses that live in moist environments. There's horses that live in dry environments. There's also horses that live in those environments that undergo man-made sources of moisture, such as poor bedding or frequent baths. How does that affect the hoof, and what recommendations would you have to the everyday horse owner on managing proper moisture of the foot?
Absolutely, and that's a huge point and challenge for a lot of horses owners. What we see a lot of here are especially during the fly season, they're at night turnout and then they're kept up in a barn during the day. So it's not only just that they're getting wet, but they're drying and wetting, drying and wetting, and it's just that cycle of moving moisture across that hoof wall several times a day. So um, typically, I don't find that there are many topicals that truly put a ton of moisture back into the wall. But what we try to do is to maybe put a barrier that flux in and out. And basically that's almost would be like a nail polish or something that is just a hard shell moisture barrier. And honestly, super glue, there's a certain type of super glue out there that I use that when I'm barefooting horses that have been in a cuff shoe and the wall is soft, then I'll just sand it, make it smooth, and actually apply sort of a gel type super glue on it. But no doubt, if you can limit that either getting wet a lot or drying, I think that it can improve some of those issues. Certainly, there are some hoof hardeners out on the market, but sometimes you have to be a bit careful with those because they can make the foot brittle. So it's kind of a fine line a lot of times. And in management, absolutely, your husbandry. If you have a horse that keeps a wet stall and they're the type that just wants to plant the then maybe looking at different drainage scenarios or bedding options to try to limit that moisture that they're getting in that regard.
So, what type of bedding tends to be the less desiccating or drying to the hoof, or what do you recommend to those horses that do have that sort of dry
You know,
hoof?
we have a ton of horses on straw in our area,
Mhm.
and straw is you can get rid of it. You can go spread it on your fields, those kind of things. So it's handy in that regard, but it's not a very absorbent material. It's just basically an empty tube of plant material. So it's not the most absorbent. So I find that a lot of times those can be sort of the less drying, whereas shavings or sawdust, those kind of things can be a little bit more on the drying side, as long as it's not crazy wet. Like a horse that spills his water, get constant or urinate quite a bit. And then there's shredded newspaper type cardboard. There are some other bedding things that I've seen here locally, people using that do seem to keep the feet a bit drier, but you do have to change them regularly.
Right.
Scott, if I can ask a question about some of those alternative beddings, some of the ones that I've heard of are coconut core or coconut fiber, hemp. Are you seeing any increasing use in those? Some of them say that they're a lower dust bedding. I'm interested to just hear if you have any experiences with those.
I've not actually. That is interesting, and certainly that is the complaint with a lot of bedding sources, the dust, and horses that have respiratory issues and those kind of things. And also, fungal type issues with eye ulcers and those kind of things. We feel like we maybe see some of those kind of things in some of the saddlebred barns for whatever higher incidence of eye ulceration with a fungal component. So we're trying to figure out why that is. But no, I've not seen the coconut bedding or that kind of thing. But that's interesting.
Yeah, it's not gained mass popularity. I've just heard of it sporadically, so I was curious if it had made it to your neck of the woods yet or not.
I'll I'll look out for it. If I see it, I'll let you know how it goes.
Keep your eye out.
Scott, so what about so just to kind of recap on that, there's some horses that tend to have a dry foot, and there's some horses that tend to have a wet foot, and sometimes that's related to their bedding. So we can try to control that. When you were talking about both hoof hardeners and moisturizers, and I like your idea that a moisturizer isn't really putting moisture in there; it's just stopping the flow of moisture in and out of the foot. Do you have any type of ingredients that people should look for whenever they're looking for one of those two types, either a hardener or a moisturizer, or ingredients that they should stay away from?
I'm not sure that there's. If you talk to three people, there will be five different opinions on which material is best. I do the ones that have like formalin based, those kind of things. I think those are the ones that they don't really stop the flow of moisture. They just basically make the disulfide bonds in the foot more rigid and harden it that way, in that manner. And there's some other things like Venice turpentine and different things out there that are quote unquote hardeners. But I think it's honestly trial and error for what your environment's asking of it. I think there's there's a lot of guys that still putting mold in their feet, and I certainly wouldn't recommend those kind of chemicals and things that you're going to be exposing yourself to. But
There's a little bit of latency there, Scott. What are they putting on the foot?
I still hear about some people putting used motor oil on horse feet. Okay. And I wouldn't recommend that.
Some of the plant-based oils, linseed oil, are there any oils that you say, yeah, those are great, or that you should, other than petroleum products, are there ones that seem to work better or not?
Not really. I'm not sure that I know of one in particular with one particular agent that I feel works better than some. Again, for me, I typically limit it to moisture barrier stuff. And there is a top coat put a coronary band that a company sells that I do feel works well for moisturizing the foot. And I don't know if it's so much the ingredients or the massaging of the coronary band that it takes to apply it every day. But I think it's a good product.
Okay, we hit another little spot of latency there. So you were saying there's an ointment or a cream that you rub into the coronary band?
That's correct. Yes.
Okay.
Yeah. So it more or less is, the idea is to stimulate growth, but I feel like it keeps the coronary band supple. Those coronary bands that are really dry and desiccated, they don't tend to grow as well. They're more prone to cracks and that kind of thing. So I feel like if you can nourish the coronary band and stimulate it, that I feel like I see more good with that than things actually apply to the top of the foot.
Okay. Interesting. Talk about some of the life stage issues that you see with horses. You're in a very dense breeding area, but you also have a lot of horses in training in your practice. So what are things that you might break down and say, foal, juvenile, in training, or performance horse, and then either a breeding animal or retired animal? What, just again, high level, what sort of things are you seeing, and what would you recommend to people that own horses of those various life stages that they may need to do that's different than a typical 4 to 5 week interval farrier visit?
Sure. Yeah. So for us, I think even if it's not our eyes on the particular case, but say 2 days, 2 weeks, 2 months are sort of early, say in the foal stage, where we're making decisions on, is this foal, is it capable of standing and nursing? Is it correct enough to be able to develop from where it is? Or do we need to have an intervention now as far as flexural deformities kind of things? So, certainly very early in their life, we're going to be looking at that or being called in if the farm manager or owner sees something that's abnormal. And then again, at 2 weeks, making sure that things are are developing as they should. Maybe they were a little bit over at the knee when they were born, or a little bit, upright in some regard, or especially fetlock varus or valgus, those kind of angular limb deformities. Then we're going to maybe start trimming that foot, or maybe even put a shoe on it to help the development of that joint before those growth plates or physes close. And then at 2 months, we're making decisions on the things that we've done. Are we where we want to be, or do we maybe need to have surgical intervention to have this this animal as correct as we can? Because there are implications for conformational issues. So if you I have a case in the hospital right now is a successful quarter horse with a very good show career, but it's fetlock varus and put a ton of pressure on the inside of its joint, and basically is now at the end of its career, because it can't sustain activity to the level that it was being asked, because of its conformation and how that changed and put stress on that joint over time.
Hey, Scott, if I can jump in there really quickly, I think fetlock varus is a really important thing that you just brought up. And I think for a lot of people, that's maybe an unfamiliar term who are watching our video. And so just to demonstrate that's basically where, if this is the fetlock, that's where the fetlocks actually angle in versus turning in. Is that how you all see it?
Absolutely. Yes. So, basically toe, with the varus deformity, as you go down, the joint goes closer to the midline of the horse. And there, again, many sort of down the road implications for being incorrect anatomically, more stress on certain parts of your knees, one side of the joint versus the other. And hoof conformation is largely a reflection of the limb above it and how it's loaded. So that's certainly something that we take a lot of time to evaluate and try to help during that critical development time if we can.
And you mentioned that this was a quarter horse that you're working with. I think it's really important for people to understand that this is across all breeds, ensuring that there's that great relationship and conversation between whether you've got a podiatrist who's dedicated to looking at conformation at that 2 days, 2 weeks period, and making some decisions 6 weeks after that, or along the course of that first 2 months of life. Really important for the soundness and life of the horse to have that great relationship between veterinarian and farrier and owner or trainer, to ensure that we're getting that the best start in life conformationally, potentially by doing something as simple as putting on hoof extensions or those types of things, to give us the best advantage throughout the yearling year and then into the training years as well. Is that right? Or can you expand on what that relationship looks like? Because oftentimes we do talk about the relationship between veterinarians and farriers and the dynamics there. I think it's really important that is super solid for the benefit of the horse. So
yeah, absolutely. I think that, and I typically talk about it as not just vet farrier relations, but the owner is a huge part of that as well. It's more of a triad for me personally. But absolutely, open lines of communication, mutual respect for where you're coming from, and oftentimes with veterinarians, we see things in black and white, and we have radiography and all these things that we can say, hey, I want this line, I want the toe cut back to this line right here, but it's a living, breathing organism that bleeds. So sometimes it's one of those things where there's two ways to get to the same place, and oftentimes if we can look more at the end goal and not necessarily at the methods to get to it's a better way to go. Because a farrier can say, well, I can't do that, but I can put the mechanics into the shoe this way, and we both have the same breakover that we're talking about, but we just got there in a different way. So I think that mutual respect and understanding the limitations of an organism is important.
Yeah, for sure. I agree with you. We see that all the time in our patients where, I by no means am a farrier, but we see it all the time in our patients, whether they're high level stakes horses, athletes, or they're just a backyard, part of the family. We see those horses that they don't follow the rules conformationally. And if we did go that hard line route, black and white, and said, hey, we want to make this pretty for a picture or pretty for an x-ray so that those lines are perfect and it fits the book, we can actually be a detriment to the horse. And I think that's something that we learn throughout our careers, and that's where that relationship and trust really develops. So I think that's important. So can you keep going through that life stage? I thought that 2 days, 2 weeks, 2
Yeah,
months.
absolutely. And so basically, with fetlocks, we're looking at those growth plates closing at 4 to 5 months, and we're most able to affect those in that first 2 to 3 months. And as the growth plate closes, it slows, so our ability to correct things slows. And when you're looking at hocks and knees, those are much farther down the road. So when a baby's born and he's very knock-kneed, the first inclination is we need to get some shoes on him to help his knees. So we might put medial extensions on, or we're asked to put medial extensions on, affecting those much more than we are the knees. The joints closest to the foot is what we're going to be putting the most correction into. So you can end up shooting yourself in the foot by trying to correct something farther up the limb while the growth plates are still open distally or farther down at the fetlock. So it's important to kind of figure out, pick your battles, and when the best timing is. So you're not sacrificing one thing anatomically for the benefit of something else. So basically we're looking at our knees and things after a year old, typically, unless it's something that's detrimental and we're having what we would call fasciitis or inflammation of the growth plates, those kind of things that would ask us to intervene earlier. But if it's just a conformational fault and something that we're looking to improve, but things are quiet and the horse is not lame and you don't have sensitivity, then we're probably going to wait until after 12 months of age to treat those typically. And I think another thing that's worth talking about is, can you hear me?
Yep.
Okay.
There's a little bit of a lag, so we're just working through that.
Gotcha.
But it looks like you're hunkered down in your office there. So I don't know if that's just a speed issue in your office, but we'll work through it.
Okay. Apologize for that. I think another thing that is critical is to let these horses get outside and be horses and develop. I think that we see a lot of foot issues that horse didn't go through and pound his feet for the first 6 to 12 months of his life like he should, because the feet, when they're born, they're 100% identical. You can't tell what side of the horse it came from. You typically can't tell if it's a front or a hind. Symmetrical, and they develop over time through the concussion and the stress that's applied to that foot. And within reason, obviously, you have to have that foot as protection, but it does need stimulation. It needs to go through its paces and and get nourished and grow in response to a healthy environment. So I think that's something, keeping these guys locked up too long or those kind of things. And honestly, with injuries and things where we have to have a protective shoe on, I would say in the case of fractures, those kind of things, I feel like there is a trade-off that we're taking away from that foot's development for a short time in order to get something to heal or whatnot. But all those things kind of need to be thought about with your shoeing plan and trimming and all those kind of things.
Yeah, I think that's really important. The point you bring up about the horse being out and moving, we know, at least in bone, that the bone develops and adapts in accordance to the stresses that are put upon it. So a horse that's out running around in the pasture is developing that bone in response to running around in the pasture, versus the horse that's standing in the stall and not having that pounding, that natural pounding. So is it the circulation in the foot, or is it actually that coffin bone moving up and down inside the hoof capsule? Is it all of those things that's benefited by being out in the pasture, would you say?
I think it's everything. I think, we see, especially you had talked about, in some of your caseload with thoroughbreds having a long toe and low heel, sort of the motor of the back of the foot is the digital cushion, and it's basically just a fibrous pad that has a lot of blood vessels and cartilage and collagen and all these things, but it's the shock absorber, and it's what allows the back of the foot to function normally, because the coffin bone is actually farther forward in the foot than most people think. If you ask somebody to draw the coffin bone on the bottom of a foot, a lot of times they're going to have it quite far back, but it's forward, and the very back of the foot is very mobile. And if that back of the foot isn't nourished and stimulated and trimmed properly and timely, then that deteriorates over time. And once it's gone, it's gone. So I do think it's everything. I think it's the interaction of concussion, the bone modeling in response to that, and also the perfusion and all those kind of things put together.
Yeah, I think that's pretty. I mean, that's really important stuff for people who are super knowledgeable about horses. They understand all of those things and the expansion and contraction of the foot. There are also those horse owners who don't understand quite as much about the biomechanics and the anatomy of the hoof, who just want to do the best thing for their horse. And so I think knowing that trimming schedule, the shoeing schedule, and how that can be variable between horses, I think is really important. A couple of other things you talked about, without getting too deep into the biochemistry and all of those things. One of the things that often comes up in conversation is laminitis. It's one of the most feared words, laminitis and colic. I think if you pair those two things together, they're the two most feared things with horses. And so can you give us just a high level of what is laminitis? Why does it happen? Maybe some of the triggers, those sorts of things. I think there are a lot of questions that people have even after they search Dr. Google, and they don't know what to believe or what to do next. It's sort of analysis paralysis.
Keith, I might interject here. I definitely have that on the list to go through, but I don't. We sort of started off with, and we're just going to edit this part out, Scott. So we're just talking freely here. We started with talking about life stages, and I don't feel like we got very far on that line. And so I just want to complete that. And then the next thing I was going to get into is diseases that manifest in the foot, and allow you to talk about laminitis at that point. But why don't we pick it up? And again, we'll try to hit the training horse, brood animals, and retired horses. And again, I mean, you kind of consider this a broad audience, and this is somebody that, maybe doesn't have a 3-year-old Derby prospect, but has they're running, weekend barrel races or going to, something like that, where we want to speak to as broad of audience as we can. So think about them. And then, again, if someone's got a stud or they've got a broodmare and they're, does the hoof care change? Does the hoof care change whenever they got an old horse? And so I'll let you kind of pick back up there, Scott, and then we'll have them blend it back in.
Okay, just a second. Because I've got a partners meeting at 2. Let me just let them know that I'm still on this. Since we're editing this out, I just wanted to get this in real quick.
Yeah, if you don't mind, and we'll try, because what we're doing is we're going a little deeper than we need to on these topics, and we'll just try to stay higher level, speak to a broader audience, and we'll try to get you out of here in 15.
Sounds good.
So let's pick up at the first shoeing. Like when would you consider putting shoes on a horse for the first time? I think would be the next part. You agree with that, Rob?
Yeah, I mean, you could. I would just say a horse that's in training. So you're going to start shoeing this horse because you're putting it in training. When does that occur? And you can take it from there.
All right. So why don't you cue it up to give it a natural place for Rob and Amanda to splice?
Okay, thanks, Scott, for talking about foals. It's very interesting. What about whenever a horse is actually transitioning into becoming a performance horse?
Yeah, absolutely. So, it's somewhat common to put shoes on horses when they start, getting more wear than their growth. So that's something that, as long as the horse is growing more foot than it's wearing away and it's sound and doing what you need, then it may not need shoes. But if you're looking for modifying the amount of traction that the horse has or a certain movement, those kind of things, then shoes may be necessary. And in our particular area, for us, start putting shoes on in the summer, their year before they go through the sales. So we're looking to protect that foot, make it the healthiest that we can. And so at that age, they're 15, 16 months to 18 months, depending on when they were born. And that would be a common time. And they're going to enter training going into their 2-year-old year right after those sales. So that would be a common time here. But they're certainly weanlings, as if a horse is wearing away more foot than it's growing, we might end up putting shoes on even younger horses. But that would be the most common time is when their activity is necessitating protection.
Okay, so we might say once they start to get broke or you start using them, they're not just running around in a pasture and growing up, but they're actually kind of coming in. We have latency there.
Typically, yes.
Yeah. Okay. Yeah. And then anything that people need to think about differently on those type of performance horses, or is it just such a case by case situation? They just have to work with their farrier on maintaining their horse during training.
Yeah, I think just try to minimize distortions in the foot, just sound farriery. Your very basic principles of farriery are what our profession and what we've been, doing for hundreds of years, and slowly improving on, obviously, modern materials and those kind of things. But at the very basic level, minimize distortions, try to make that foot as healthy as it can be. And a lot of times trying to mimic the barefoot condition, even in a shod foot, very thick shoes that have the frog way off of the ground, you're not getting stimulation in that back of the foot, or you start seeing some hoof architecture issues with things. So just keep in mind that try to make, even though it's a shod foot, try to make it its healthiest version of itself through that shoeing.
Okay, great. Now, what about transitioning maybe over to being a breeding animal? Is hoof care any different for those?
Obviously, our goal is to have them barefoot, if at all possible. When, especially in our environment here, when these horses come off the track, they've been in race plates, they've been in a very light shoe, in a very sort of routine and protected environment, in a shed row going back and forth to the track, those kind of things. And what they're asked to do activity wise is very different than what they'll be as a breeding animal. We say commonly that we have some foot issues with maiden horses that come off the track, and they're in that transition period. So a lot of times we'll end up putting a glue-on shoe because they get sent to the farm and they have race plates when they get there, and they'll pull their hinds and they'll just leave their fronts on and say, well, we'll just leave them on until they fall off, and then we'll get our farrier to start taking care of it. If they lose the shoe, or if they've had some hoof wall quality issues already, then that can be kind of a tough time, a challenge, sole death wise and those kind of things. So it's common for us to maybe come in and put a glue-on shoe that gives some sole protection and just give them that ability or time to build some sole depth and some wall quality until we can get them barefoot. But that's always our goal, is to have them barefoot and just out there living the good life, making babies.
That's right. And what about towards the end of life, or just even late teens, 20s, senior horse care? Any problems or things that people need to be more concerned about?
Well, I think, the accumulation of injury and stress over time, sometimes hoof quality, you've had more time for that foot to adjust to the conformation limitations of that horse or its environment. So they might be growing foot more or hoof more slowly, or some of those kind of things, especially if you have some nutritional deficiencies. The dentition is not as good as it was when they were younger. You might have some issues with those kind of things. So yes, absolutely. And obviously laminitis and the things that can trigger that can be more common in aged horses. So yeah, the hoof care is certainly very important in an older horse.
Right. And a good segue. So talk to me a bit about diseases, systemic diseases that manifest in the foot. You mentioned laminitis. That's, I'm sure, a big part of what you work on. Do you mind just sort of giving a broad description of what that is and what tends to cause it, and maybe some very high level things of how you manage it?
Absolutely. So laminitis is inflammation of the lamina, and that's basically the interconnection of the hoof wall that we see from the outside and the suspension, the apparatus that holds the coffin bone, that pedal bone inside the foot. And it's basically a highly specialized connective tissue within the foot that is very susceptible to stress. It's an amazing design, and the ability for the horse to have all that weight on such a small footprint is mind-boggling. It's also its Achilles heel. So all kinds of triggers. Laminitis is certainly one of the most frustrating things that I deal with as a practitioner, because sometimes, despite all the advances that we've made in therapies, we still are often unable to help some horses, and that's heartbreaking for the owner. It's definitely something that that is a big cause of stress and obviously loss of life in horses. So some of the things that can be triggered are just getting into a bag of sweet feed in the barn. Lush grass we have great grass here in central Kentucky, but it can be the detriment to some horses. It's just so rich and full of sugar. And other things are just mechanical issues, just too much stress on the foot. one abscess on a foot and it loads the other one too much. It's all kinds of that, but probably one of the more common things would be insulin resistance or equine metabolic syndrome, and it's similar to diabetes in humans, but the body quits listening to the insulin within it, and it causes issues with the feet. And the other one would be PPID, which is the older term for it is Cushing's disease, but that's where the body's making too much internal steroid, and that's bad for the feet. So those are some of the very, very common causes.
Yeah, and Scott, so I just put this schematic up there because I know you're describing laminitis. How do you mechanically address laminitis? I know that's a really broad question, but what are the general things you're trying to do to get that hoof on the right there, that you can see that bone, that tan pedal bone sort of working towards the sole? How do you help out those horses with farrier and podiatry?
That's a huge point. And it's what we're typically trying to do is minimize leverages. We're trying to reduce tension in the soft tissue that connects to the coffin bone, which would be the deep digital flexor tendon. We're going to oftentimes add some wedge into that to try to reduce that strain. And when we wedge them, it brings the weight bearing, the center of gravity a little further back in the foot, hopefully away from those more compromised tissues in the very front of the foot where you see the rotation. And oftentimes it's just protection. We're trying to, if that sole is incredibly thin where the coffin bone is protruding or almost protruding through them, then we need to give it some rigid protection. But typically we're going to try to put sort of much in place that makes the bottom of that shoe more like a rocking chair, try to reduce the tension on that coffin bone and give as even weight distribution as we can.
Fantastic. Before we let you go, anything that people need to do in terms of feeding or supplementing their horse? Everyone wants to make sure they're doing everything they can to grow the best foot. Are there things that you find nutritional components or feedstuffs that really help with that, or is it just tend to be a horse to horse variable? It doesn't matter what you feed them, they're always going to have a great foot or a poor quality foot.
No, I think I've seen horses benefit from supplementation. I think it advances in figuring out why some horses aren't getting what they need, be it disease gut, do they have limited uptake nutrients, is there some reason why a normal balanced ration isn't providing what they need? And and I think that can be quite variable, and it could be regionally dependent as well, where you have maybe some nutrients in an environment or from the forages that you're feeding that there's plenty there, where in a different part of the country it's not, and maybe getting that stuff tested could be beneficial. But I do think that I have seen supplementation help, and I've also seen where we've tried everything under the sun, and for whatever reason we still have quality issues or growth issues, those kind of things. So it's very variable, but I think in some cases, especially when you're throwing the book at this horse and you still aren't happy with what you have, it's at least something that you need to try, and you're taking expensive manure, but it's I think it's worth trying.
Yeah, I know we all personally you can do that to ourselves as well, but I appreciate the comments, Scott. I know you're busy and you're doing great work there in Kentucky. Thanks for taking time out of your day to join Keith and I. Again, we look forward to seeing you on another giving trip in the near future, and be sure to pass on our regards to all your partners and associates there at Rood Riddle. Absolutely. It's been a pleasure. Thank you so much, guys.
Thanks, Scott.
All right, brother. We'll let you get that partners meeting. Thanks for joining us.
Hey, if there's something that you don't like and you want to edit something else in, I'm totally cool to adjust something. Or if there's something else that you're looking for, just let me know. Does that sound cool?
Oh, I think it's great.
Yeah, I think it's good. It'll work exactly for what it is we are putting out there to our audience. So I think it's great. I think that the one thing that we could add in there is that for all their lives, from the day that they're born until the day that they're no longer with us, these horses are standing basically on the equivalent of our middle finger. So we've got 1,000+ pound horses standing on what would be our middle fingers and toes, and their legs are built like suspension bridges. So the importance of that foundation of that foot is really everything up the leg from there throughout their life. So when we think about it that way, what you do and your colleagues do at Rood Riddle are critically important to the health of the horse and their well-being throughout their life. So it's awesome that there are people like you out there doing that work.
Well, certainly lucky to get to work on, on the horses. A lot of admiration for that. So it's been a lot of fun.
Awesome. Thanks, Scott.
All right. Thank you, guys.
Hey, bud.
Take care. Record on the cloud. We are recording. Hey, everyone. That was Dr. Scott Fleming at Rood Riddle, one of the great podiatrists in our industry. Remember, if you like this video, be sure to subscribe to the Full Bucket channel for more exclusive content on helping your horse to be and perform its best year-round. Also, check out fullbuckethealth.com. We're the leader in digestive care supplements for horses and have been trusted by over 5,000 owners to help their horses get back on track. We'll see you next time.